The key to allowing people to see in extremely dark conditions is a chemical substance called chlorine E6. It can also be called phytochlorine on some occasions. CE6 was originally used for cancer treatment as a therapy agent. However, other uses of CE6 have been discovered in recent years. The most notable in this case is that it can be applied onto the conjunctival sac of the eye as a treatment of night blindness and improving the dim light vision. The patient in 2012 claims, when the mixture of CE6, insulin and saline is applied to the eye, it will be absorbed by the retina, which helps to increase vision in low light. The patient has also mentioned that the insulin can be replaced by dimethyl sulfoxide, otherwise known as DMSO. The Science of the Masters team proposed that the combination of the two will be more effective. Chlorine E6 plays a huge part in making our eye treatments work. Without it, our products will not work. Our eye treatment is also available in weaker doses for young children and the elderly, so everyone has the opportunity to experience seeing in dark conditions without the light. Another point we would like to make is that our products are not tested on animals. For one, testing it on animals will not produce the same outcome that they would on human beings. Also, we wouldn't want to put off people from using our products. Our eye treatment is Vegetarian Society approved. Night vision eye drops. The whole idea of the night vision eye drop came from a dragonfish. The cells in our eyes detect dim light with a light-sensitive protein called rhodopsin, and rhodopsin is the most sensitive to green light. In the deep-sea dragonfish, though, their rhodopsins were responding to red light. There was a second odd observation. Their eyes contained a chlorophyll derivative that also absorbed red light, suggesting that perhaps this chlorophyll derivative was attaching to the rhodopsin to make it sensitive to red. After a lot of thought and preparation, we used a baseline test because everyone has different eyes, and the placebo effect to determine if our idea will work or not. Next, we use an electroretrogram, or an ERG. It's a technique commonly performed by eye doctors that involves hooking up electrodes to the cornea and skin around the eye to measure the activation of light-sensitive cells in the retina. The test gets rid of the subjectivity inherent in the question, can you really see? Finally, we add the chlorine E6. By adding both insulin and dimethyl sulfoxide, which increases permeability to the saline solution, normally just insulin is used in conjunction with CE6 and saline. The compound will work by influencing the way our retina's light-sensing rods work in the dark. The effects will start to kick in after an hour, and you will be able to see over 50 metres in complete darkness. In addition to treating the disease, CE6 could be used to enhance night vision in soldiers, night patrollers, police, night drivers, factory workers and anyone else involved in work, travel and fun after the sun goes down. Night vision contact lenses. Graphene, the ultra-thin, ultra-light, ultra-flexible, ultra-strong material that has the potential to be used in all kinds of groundbreaking innovations, is revolutionary modern material that we use to make our night vision. It can absorb light from all wavelengths, and they are both incredibly thin and incredibly powerful at the same time. The lenses will be able to sense the full infrared spectrum, plus visible and ultraviolet light. The graphene can detect infrared radiation at room temperature, again not requiring cooling. Being so small, the graphene can only absorb a very small fraction of the incoming radiation, perhaps as low as 2.3%. However, we took advantage of the tunneling effect, where electrons are freed by radiation hitting the lens, forced their way through the central insulating layer despite not being particularly energetic. This allowed the incoming radiation signal to be amplified, making the device more sensitive than it otherwise would be. As this study shows how effective incredibly small, incredibly sensitive graphene-based NV devices can be, it might not be long before the technology is mass-produced, bringing other sci-fi concepts into the real world.